What separates a thriving, low-stress, high-profit practice from one that's just average? I've worked with hundreds of dental practice owners, and I've also lived it myself, and I can tell you this. The top performing practices do these three things consistently. They are not flashy, they're not complicated, but they're powerful. So if you're ready to have a high-performance practice, stay tuned because I'm going to show you exactly how easy it is. For those who don't know me, my name is Dr. Paul Etchison. I'm the author of 2 books on dental practice management. I'm the host of the Dental Practice Heroes podcast. I'm a dental coach, and I'm the owner of a large group practice in the south suburbs of Chicago. My goal is to teach practice owners like you how to create a team-driven practice that is low stress, high profit, and gives the owner the freedom to live an amazing life, all while taking great care of your patients. All right, let's talk about these 3 magic things. The first thing that high-performing owners do is they solve the new patient problem. What I mean by that is they generate at least 35 new patients per month per doctor. So how do they do it? Well, it's probably what you thought, marketing. But let's clear up a common misconception. Not all marketing is created equal. Let me share a story about my brother to help illustrate what I mean. Now, my older brother, after his divorce, he started dating. This is probably about 2015, and he gave this app called Bumble a chance. This is one of those ones where you make a profile and people swipe left or right, and they'd see if they can connect you with people. So he's showing me this, and I'm going through his Bumble, and I'm swiping left and right for him. I'm just checking it out, kind of living vicariously through him. And I said, "How many matches are you getting?" And he goes, "I haven't got any." And I'm like, "Huh? Really? How long have you been on this?" He's like, "A few weeks." I'm like, "That's really weird. Let me see your profile." He opens up his profile. He's got 3 pictures in there, and I thought it was a joke. I thought he was kidding. I was like, these are the 3 worst pictures ever. 1, you look like a scumbag. You look filthy. You're not put together. You don't look well groomed. Your hair is like hanging in front of your face in this one. 2, you're not even wearing sleeves in this other picture. And 3, you look pissed off in all 3 of these pictures. So let's talk about this. Just because you're marketing doesn't mean you are marketable. So my brother is on the app, he's marketing, but there's nothing marketable about him. He's not portraying himself in a positive light. So I want you to do this. Look at your practice. Look at your website. Look at the videos on your website, maybe the pictures. How are the finishes at your practice? Are they up to date? What does your practice look like? If you were a prospective new patient and you landed on your webpage, would that be a practice that you would want to go to? And what I see so often is that doctors are pumping all this money into marketing, and then you look at their website and you're like, your practice is hideous, your website looks hideous, and there's nothing on here that says, "Hey, prospective new patient, this is a reason you should come here." So you've got to figure out how to make yourself marketable. Then you got to put yourself out there with a good website, quality photos, quality layout, quality videos on there, and have something marketable about your practice. One of the things that we did at my practice is we were open early, we were open late, we would see same day emergencies, we had high tech, we were high quality, all these things. Don't just be a generic dentist. You know that dentist at the strip mall and it says dentist, sign just says dentist? Generic, average, don't be that. You want to stand out. Take what's marketable about your practice and market that. All right, number 2, dentists schedule intentionally using blocks. Now, back in the day when I opened up my practice in 2012, we were just kind of getting people in whenever they could. We put them here on the schedule. It doesn't matter. There was no rhyme or reason. Do they fit on the schedule? Put them there. And this is what we would have. We'd have some days where we ran like crazy. We'd be adding same-day dentistry. We'd add a crown. We'd do an Invisalign start. We'd have this huge high production day. And then the next morning, we'd have half the day off because we'd have all these openings in our schedule. So one day I sat down and I said, "Hey, wouldn't it be nice if instead of having one big day and one small day, is if we just had about even days?" And they were all chill. We never got stressed out because we were overbooked. We never got behind because we made sure we stuck to our schedule, but they were all consistent days. And we can do this. And that's what high-performing dentists are doing. They're setting up their schedule intentionally using blocks. They might be saying, "Hey, we're going to do 2 crowns each day. We're going to do this amount of filling procedures each day." And then when they fill their blocks and they know they're at their production goal, they don't add any same-day dentistry because there's no sense in doing it today if you've got openings tomorrow. So that way you get consistent days that are intentionally scheduled that make sure that you're hitting your production goals. So get intentional about your schedule, use a blocking system, and this is what I teach in my training program at Dental Practice Heroes. If you're interested in that, it's dentalpracticeheroes.com. Number 3, they communicate with their team. Just like a healthy marriage, a healthy practice culture needs communication. Have you ever went through a period in your marriage where life gets busy, the kids are busy, you don't make as much time for each other, you're not doing date nights, you're not really taking time to connect, you get in bed at night and you flip around on your phone and you go to sleep and you don't even really have a chance to talk? Yeah, we all go through those periods in our marriage. And what happens? Before you know it, we're like, gosh, you know what? I don't feel that close with you right now. We need to set aside some time to talk and communicate. So in order to have a functional, happy marriage, you've got to communicate. You need to make it a priority. Otherwise, it gets lost in the chaos of life. So you need to put in that time, you need to talk about your issues, talk about your feelings, and just sometimes just to make some eye contact and connect. So that means date nights, setting aside time to check in with your spouse, putting down your phone at night and making eye contact. Now let's talk about at the practice. It's no different there. You're going to have one-on-ones with your team members. One-on-one meetings asking them how things are going. You're going to have monthly meetings where you give the team a chance to communicate and talk about what's going well and what's not going well. If you have a leadership team at your office, you need to meet with your leads once a week, maybe once every other week, so that you can talk about the issues and where you're going as an office. Another thing that's important is no matter how you're meeting, because you need to make sure when you're meeting that it's productive. You're not blaming people. You're not pointing fingers. It's about finding solutions. What is going well? What's not going so well? And if something's not going well, what can we do to improve it without blaming people and shaming people? It's not about making people feel bad. It's about coming up with solutions as a team. We're collaborating. So that's how you build momentum and you build buy-in with your team. You've got to talk to your team. You've got to provide those vehicles and those opportunities to allow the communication to happen. So schedule the meetings and make them a priority. So to sum it up, in order to have high-performing practice, you don't need to reinvent the wheel. You just have to get consistent about those 3 things. 1, you've got to figure out how to see 35 plus new patients per month per doctor. This is something I teach you how to do in the Dental Practice Heroes training. We show you every way, internal marketing, external marketing, patient experience. We show you exactly how to do it. And number 2, you've got to get intentional about your schedule. You've got to use blocks. You've got to set aside time for high production procedures, set aside time for low production procedures, and make sure that your days are consistently productive. This is also something we teach you how to do at Dental Practice Heroes. And lastly, you've got to communicate regularly with your team. You don't blame, you don't point fingers, you collaborate constructively. So if you want to learn how to run an amazing practice that allows you to take off 12 plus weeks off per year, to cut your clinical days down to 3 or less days per week, check out dentalpracticeheroes.com and learn how to live an amazing life as a dental practice owner with an insane amount of freedom that comes from running a high performance, high profit practice, and all the while taking great care of your patients. If you like this video, please subscribe to the channel and check out the Dental Practice Heroes podcast for weekly episodes to make you a better owner. Thank you so much for watching, and we'll talk to you next time.